Hello, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today is Dr. Chad Storch, board-certified occupational and aerospace medicine,
correct,
and outreach liaison Dusty Hirsch. Glad to have both of you guys here. Thanks for coming in.
Thanks for having us.
Yeah, thanks for having us.
So, Doctor, I'm sure you've seen lots of just terrible accidents in the radio business. Those of us that are really inept at just walking down hallways and things, right? Do you ever get a lot of accidents from my profession, Doctor?
No, I haven't had a single radio station personality injured at work yet.
Well, your specialty, of course, is occupational medicine, correct?
Correct.
And let's get a little bit of background on that as we start today, on just kind of overall what it is, Doctor.
So sure, we see our practice in particular, we see about 70% of our practice is made up of work comp injuries, just what you touched on. And then the other 30% is various physicals from all walks of life. If people need a pre-employment or post-offer physical, we do physicals for the DOT, FAA, FBI, stuff like that.
Okay. Well, then, Dustin, how do you play into this as being one of the workforce wellness? That's your area of expertise.
Yeah, so Monument Health came out with workforce wellness in 2019. Essentially, workforce wellness is basically bringing the occupational medicine out to the employer, because we all know, especially from COVID, that your employees are your greatest asset you have. Without employees, you can't have a business. So we do many different things in the community for local and national companies, but like this time of year, of course, it's ramping up for flu shot season. We've got a new COVID shot coming out, a new vaccine there. So that's part of what we do. We do a lot of health fairs for school districts, for police departments, for counties. We do quite a few different things on the community, as far as Monument Health and occupational medicine.
Okay, so that's you're out. It's an awareness thing for you, then, correct?
Yeah, I mean it could be more some awareness.
Sure.
We've had Dr. Storch and I have been out to several companies in the Black Hills that have they do a lot of heavy moving different things. So we help them with ergonomics. That's part of it as well. Just make sure they're healthy backs and healthy lifting and whatnot. Different techniques they've got. So
well, in this area, we seem like you guys specifically would see a lot of that type. I mean, we're kind of a blue collar area of the country, aren't we? Is a lot of that, or is there more white collar? That would be really interesting to talk about too, just the difference between those and kind of what we make up here in Rapid City on this part of it. Where do you see most of the injuries that come from work?
I think you're absolutely right. I do see a lot of what you would term blue collar employees certainly getting hurt at work. Yeah, but we do have we have folks in a white collar industry, if you will. If you
Sure.
want to consider healthcare, white collar industry, I see a lot of healthcare injuries. Nurses and nurses' aides, and they get hurt at work just as often. I'm sure there's statistics out there that could drive this home. I don't have those.
Oh, of course, right.
Yeah.
Well, where now you, Dustin, you're local, right? You were born and raised here, South Dakotan.
Piedmont, you bet.
From that area, you've decided that this is home, baby. This is where I'm going to be from.
Yeah.
So how did you pick this area to go into?
I came from a big box retail management, and I just wanted something different. All my family, my mom, my sister's a nurse currently, so got a lot of family nursing. A lot of family worked at Monument Health. I knew it was a great place to be, so I started off in marketing as an outreach liaison, and kind of about 3.5 years ago came over to the occupational medicine side. So it's been a great fit with Dr. Storch and I. We also have a few other providers in our practice as well.
Okay. And Dr. Storch, you're brand new really to the area up here.
3 years.
You, of course, in the Navy for 20 plus years, I believe.
21. Retired in 2021.
And you came up from Florida.
Sorry, retired in 2020. I did. I retired out of Pensacola, Florida. I was a senior flight surgeon down there at Whiting Field, just north of Pensacola. Yep. Yeah. Okay. And came out here because Monument Health had a job that checked all the boxes that I was looking for. I wanted a turnkey practice. I wanted a mentor. And,
well, did you choose this profession before or after you decided to join the Navy, or did one kind of lead to the other a little bit?
Well, in the Navy, my role was more aerospace oriented.
Okay.
My residency was aerospace and occupational medicine, but my role, like I said, in the Navy was more aerospace oriented. So I had to learn more of the occupational side of things once I got out. That's why I wanted a mentor, because we don't have workers' comp in the Navy. And so, having to learn workers' compensation laws here in South Dakota and how to handle workers' compensation care.
Well, without getting too far out in the weeds, there's no workers' comp in the military?
Well, no. Everybody comes and sees their doctor, and we, they either go back to work or they don't, but there's no workers' compensation per se.
Okay. You mentioned here when we started too, and one thing that, when you go to the doctor sometimes, or you go into like an urgent care, I think really is where I mainly see this. I will always see here you can do your DOT physicals, right? That always seems to be a sign that pops up in a lot of places like this. And every time I've had to go to an urgent care and I see that, I think, well, what's the difference between a physical that I'm going to get and one that the DOT has to have, or an FAA physical?
Right.
So I'm glad you're here to this is purely for me. I'd like to know what is the difference? Why are they singled out?
So the difference is, the intent of those physicals is because we have folks flying over your home or driving large vehicles on the road. The intent is to make sure that those folks that are operating those vehicles are safe to do so, right? So they're free of any medical conditions or mental conditions, and that they're emotionally prepared to handle the rigors of either flying an aircraft or operating a large vehicle that requires a CDL.
Okay, so you mentioned mental health in there too, which a lot of times when I go to get a physical once a year, that's not normally a part of this. So as a doctor of occupational medicine, is that a big part of your field as well?
I wouldn't say so. It's just it's one of the things that we have to make sure that our applicants or our employees are that they're being, if they have mental issues, that they're being adequately treated. Now, I'm not here to provide mental health, I'm just to make sure that they're being adequately treated. If they're on medications for, say, anxiety and depression, then we want to make sure that they're seeing the doctor who's managing that condition on a yearly basis. And that's what we need to do to make sure they're safe on the road.
Okay, so who would need a typical Department of Transportation physical?
So if you're a CDL holder and you're operating, typically operating a large vehicle, right? So we usually connect the DOT drivers with driving an 18-wheeler, right? But it doesn't have to be an 18-wheeler. If you're driving a vehicle that has hazardous materials in quantities enough to require a hazardous placard on it, then you need a DOT physical for that CDL class.
Okay.
And then if your vehicle is, say, carries more than 15 people, okay, if it's designed to
like a bus driver or something like that. Oh, okay.
Or even a smaller vehicle, and you're getting paid to transport, say, 8 people.
So can any doctor do these types of physicals, or do you have to be an occupational medicine doctor?
You don't necessarily have to be an occupational medicine physician. You can just take the course to do the DOT exams, and once you become an examiner for the Federal Motor Carrier Safety Administration, then you can do those exams.
Excellent. Now, as FAA, going into that physical, does that you were aerospace medicine is in your title as well?
Correct.
Explain that a little bit.
So it's a fancy title for being
awesome.
a flight surgeon in the Navy, and that's a misnomer in itself. You're neither a pilot nor a surgeon, but you're a physician that specializes in the care and treatment of aviators.
Okay.
Right? And so we understand the rigors of operating an aircraft at altitude and what that does to certain disease processes and what to be on the lookout for. And so that's really what we do as a flight surgeon. Now, the residency in aerospace medicine also allows you to be the senior medical officer on an aircraft carrier. So it's kind of a check in the box thing in a career pathway. And unfortunately, I didn't end up on an aircraft carrier after residency, which was my intent.
Would you have wanted to be?
That's the whole reason I went into aerospace medicine and became what's called a RAM in the Navy.
Okay.
Residency in aerospace medicine. But I didn't get an aircraft carrier. Instead, I got a senior medical officer position at one of the bases, and so I was happy with that.
Do we have a lot of pilots that need these kind of physicals around here? Do you see them frequently?
Well, we see, I see, probably a handful a month. Unfortunately, I don't do the what's called an air transport pilot physical. Those are let's say your Delta pilots.
Okay.
Right. That's a Class 1, but we do Class 2 and Class 3. And Class 2 would be your pilot who's flying and receiving money to do so, even if it's just a crop duster that's getting paid to do crop dusting, or
Right.
you're a balloonist and you're taking folks up in a hot air balloon and they're paying you to do it, then you need a Class 2 medical certificate.
I never even thought of that. Yeah,
That's
because we have the
newer. They just required that thing about a year ago.
for the hot air balloons.
Yeah.
Oh, really?
Yeah.
Well, it makes sense. I mean, if you're taking anybody up that high in anything, I want to make sure you're healthy doing
Sure.
it.
There's been some tragedies out there.
Yeah, exactly. Another one that we had on the list to talk about here was an immigration physical. Now that I'm really curious about too. What is that about, Doctor?
So when you're applying for citizenship here in the United States, there's a form called the I-693, and it's a medical examination form that has to be filled out by a physician, and it requires a physical exam and a review of your vaccination history.
And do we get a lot of those here too that you deal with?
We absolutely do. I see a couple a week.
No kidding, that many.
Yep.
Well, you do see a lot of people that take their citizenship. They receive it up at Mount Rushmore, which is kind of cool. Usually when that happens. So workers' comp, of course, everybody is familiar with that term. Is there? What are the limits with workers' comp? When should people see you for a workers' comp claim generally?
So they should be seen if they're hurt at work, right?
And it can be like any kind of hurt, right? I mean, it's...
Well, typically if it's beyond first aid.
That's a good point. Okay. Because a lot of times, you will see people that'll twist their ankle or bang their knee or something like that and be like, oh no, I got to go to HR and I got to get to workers' comp. But so beyond first aid then, that's any serious type of injury, obviously.
Sure, and the majority of them are seen and cleared through urgent care before I see them.
So you can go to urgent care with a claim like that. Now,
That would be the preferred route.
they specifically come to see you then?
They're usually referred by the urgent care folks.
Okay. Can they go see their normal doctor for something like that, or do you have to be the one that signs off?
No, absolutely. They can see if they have a family doctor here in town who does, who is comfortable handling workers' compensation. Yeah, absolutely.
Then that's the way to do it. Okay. Well, there's this is the things that I find so interesting about this are, it seems like you do very specific types of obviously physicals, and then seeing people that do this sort of thing. Is this how different is what you do just from a normal doctor? And I'm not saying you're not a normal doctor. Of course, I don't mean that.
Question,
I mean, you're a doctor.
You're
You're right. Yes, totally. But as occupational medicine, it is a specialty then, correct?
It is, and we're getting away, and when I say we, I mean the occupational medicine physician. We're kind of getting away from what the training was in the past. Excuse me, not the training, but what the practice was in the past, where we dealt with a lot of industrial exposures and
Maybe that's what I'm getting at,
type
yeah.
injuries and stuff like that. That we've kind of moved away from that. We don't routinely test folks for lead exposure or any other chemical exposures. That's not to say that doesn't happen and doesn't still exist to some extent in some industries, but by and large, I think the practice has become more specialized in terms of seeing workers' compensation patients, seeing and performing specific physicals 70% of our practice is workers' compensation. I see a ton of that. So.
Is there repetitive things that you see over and over from workers' comp injuries? Common things?
Back injuries are certainly very common. And then one of the more concerning trends that I've seen since I've been here are healthcare workers getting hurt by patients.
Oh, really?
Yeah. So I've seen, they get assaulted by patients.
What then, going back to you, Dustin, coming up this fall and this winter with the outreach stuff, you were talking about flu shots and COVID shots, of course. Do you kind of have a seasonal list that you run through for outreach every year?
Kind of. I think the fall is the busiest for me, October, November, with the on-site vaccinations. Then the end of the summertime, and I'm kind of going backwards, but we do schools that are coming back for the school staff for several schools out here. And then it seemed like in the summertime, in the spring, we just do a lot of on-site health fairs. Those are getting popular. So if you're a small or a large business owner, or maybe you're just an employee health representative, like a construction company, if you don't like the employee wellness plan that you're on, if you even have one, a lot of these companies just do the drug testing. They might do a pre-employment physical, and then that's it. So it seems like, I said, since COVID, the last 24 months, I would say, these companies are kind of starting to see the why it's good to put a few bucks into their wellness. I think it's for every what is the number? For every $1 you spend on employee wellness, you save $5.60 on your employees, whether that's rehiring and having to train your hires, or having folks get hurt and having to see doc over here and be gone for 6 weeks. There's a lot of different, obviously a lot of different variables that go into that math, but it's well worth to spend a few bucks for your folks versus just a simple, drug test and have them lift 50 pounds and okay, you're good. There's more things we can do to keep, obviously some jobs, you're going to have high turnover anyways. I can see the business owners not investing a ton in there, but some of these other companies that we have in town, some of these big, like Skull Construction, they're great to work with. They do a lot of work with their folks. There's other companies that I think, obviously it's up to them and their bottom line, what they want to spend, but to me it's well worth to keep us in the loop and have us come on site and do some ergonomics and different things like that.
Well, how do they get a hold of you guys then? If there are businesses that hear this, they'd be like, well, that's a great idea. I want to absolutely be a part of this. Then how do they get a hold of you?
Well, you can call me directly, of course.
Okay.
My number, we can post it there, but I'll say it right now. It's 605-755-9166. The best thing to do probably is to go to monument.health, and you can, in the search engine, you can search for workforce wellness, and there's you can submit an inquiry tab, and that goes directly to me. I think they ask me 4 or 5 simple questions, make sure it gets directed to the right person, but ultimately I see all of them, so I take over all of them. If it's not something that I do directly, then I hand it off to who would make sense. But most of them just come to me and I handle them. Okay, excellent. Well, I know when I'm done here, I'm going to get off my chair very carefully, and I'm going to walk to my office and finish the rest of my day. Because I was trying to think before we came in if I've ever had anybody that I've worked with in this business do workers' comp, and I did. I actually worked with a guy that one time got struck by lightning while he was out doing a live broadcast for us. And that was the only claim I can remember. And I'm thinking, good Lord. What would you do for him?
Yeah, we go big when we do workers' comp here, right?
One a decade.
Yeah, exactly.
Hope him put his hair back down. We don't have that problem.
Yeah, now he's mostly bald too. Yeah, he just decided to forget the whole thing. Dr. Chad Storch, board certified in occupational aerospace medicine and outreach liaison, Dusty Hirsch. Thank you guys both for coming in and talking about this. I really appreciate it.
Thanks for having us. We appreciate it.